So naltrexone can often be used to reduce drinking, with your goal being harm reduction, and that is reducing the amount that you drink and becoming more of a controlled drinker or moderate drinker. And the concept of harm reduction is really unnecessarily controversial, in my opinion. So there are people on one side who say abstinence is the only way, no matter what. And often it is people who come from a 12-step tradition, and it's hard to argue with them. For a lot of people, abstinence is the only way. If you get to a certain number of consequences and your life is one step away from the grave, abstinence is the only way. For people who haven't had as severe consequences, though, and have a focus on improving their health, harm reduction is a way to get away from the harmful aspects of drinking too much. And a lot of those are physical. So alcohol's impact on the liver, the heart, your bone marrow, your endocrine or hormonal system, multiple different systems are adversely impacted by alcohol. And so some of those can kill you. I mean, if people have heart issues from excess alcohol use, you can get cardiomyopathy and develop heart failure. If you develop liver failure, that actually can also be fatal. So the reality is reducing from a certain amount of alcohol on a daily basis or weekly basis to another level will essentially more or less save your liver, save your heart, and save your bone marrow. It's not a popular message because people will go, well, if you're drinking 3 drinks a day or 4, that's still too much. It's still bad for you. And frankly, that's kind of a borderline amount of alcohol to impact your body. But if you come in drinking 12 to 15 drinks a day, or even 8, and you can get to 3 or 4, what I tell people is you've saved your liver pretty much. Now, would 2 a day be better for your liver? Absolutely. Would 0 be best for your liver? Absolutely. In terms of sort of almost ensuring you're going to ruin your liver with 10, 12, 15 drinks a day, you've put yourself in a position of self-preservation. Naltrexone as a medication to treat heavy drinking works best in people who are actively drinking. It can be used for people who are already sober to keep them sober. And in fact, that was one of the original indications. It came out in the mid-90s. This medication's been around. But it seems to work best clinically in people who are actively drinking, who drink most days. And then the cadence is that you take the medication every day, and you take the medication often an hour or 2 before you normally start drinking. It's a concept called targeted dosing. It seems to help. I think people like the accountability and the structure also of then planning ahead. Because part of it, you're taking your medicine at 4:30, you get home at 6, your usual routine is to start drinking. At least taking the medication, it's the physiological benefit, but it's also the thing of like, you're making a mental mark of like, you're planning ahead. So that also helps. It's not just the medication, it's you going, okay, rather than having 5 or 6 cocktails tonight, I'm going to try to have 2 or 3. So essentially, it works well for reducing. And naltrexone is probably the best medicine we have for reducing. There's also the concept of the Sinclair Method, which, from my point of view, seems to work best in binge drinkers. You can use the Sinclair Method drinking, I think, optimally 2 or 3 times a week. In preventing heavy binge drinking on a Friday night or a Saturday night. So with the Sinclair Method, you take the medication an hour or 2 before you intend to drink, and that the physiological effect is that the alcohol won't be as reinforcing. People say, just didn't have a taste for it after 2, or I wasn't getting much out of it. And so people will report it in different ways, but the goal is to help you drink less so that tomorrow morning you don't wake up with a hangover. You don't wake up needing hair of the dog to drink first thing in the morning. Your body is thanking you. Your sleep is thanking you. A lot of positive attributes to drinking less.
For expert support on medication-assisted treatment for alcohol use disorder, visit riahealth.com.